Erythroblastosis fetalis is a blood disorder that affects babies before birth. It is also known as hemolytic disease of the newborn, HDN. This condition occurs when the mother's immune system attacks the baby's red blood cells. This attack is triggered by a mismatch in blood types between the mother and baby. The most common type of mismatch is Rh incompatibility. The Rh factor is a protein found on the surface of red blood cells. Some people have it, and some don't. If the mother is Rh negative and the baby is Rh positive, it can cause problems. During pregnancy, a small amount of the baby's blood can enter the mother's bloodstream. If the mother is Rh negative and the baby is Rh positive, the mother's body will see the baby's Rh positive blood as foreign. Her body will start making antibodies to fight it. These antibodies can cross the placenta and attack the baby's red blood cells. This can lead to a range of health problems for the baby. The severity of the condition can vary from mild to very severe. The primary cause of erythroblastosis fetalis is Rh incompatibility between the mother and baby. This occurs when an Rh negative mother carries an Rh positive baby. The incompatibility arises because the mother's immune system recognizes the Rh factor on the baby's red blood cells as foreign. This immune response leads to the production of antibodies against the Rh factor. These antibodies can cross the placenta and enter the baby's bloodstream. Once in the baby's circulation, the antibodies target and destroy the red blood cells. This destruction of red blood cells is what causes the symptoms of erythroblastosis fetalis. While Rh incompatibility is the most common cause, other blood group incompatibilities can also lead to erythroblastosis fetalis. For instance, differences in the ABO blood group system can also trigger an immune response. However, these cases are typically less severe than those caused by Rh incompatibility. It is important to note that not all pregnancies with Rh incompatibility will result in erythroblastosis fetalis. The likelihood and severity of the condition depend on various factors, including the extent of blood mixing between the mother and baby, the mother's antibody levels, and the number of previous pregnancies with an Rh positive baby. Erythroblastosis fetalis can cause a range of symptoms in an unborn baby. The severity of these symptoms can vary depending on the amount of red blood cell destruction. In mild cases, the baby may experience mild anemia and jaundice. In more severe cases, the baby may develop hydrops fetalis. This is a condition where fluid builds up in the baby's tissues and organs. Hydrops fetalis can be life-threatening and requires immediate medical attention. Diagnosing erythroblastosis fetalis involves a combination of blood tests and monitoring the baby's health during pregnancy. Blood tests are used to determine the blood types of both the mother and the baby, as well as to check the mother's blood for Rh antibodies. If antibodies are detected, the baby's blood will be tested to determine the severity of the condition. Throughout pregnancy, doctors closely monitor the baby's growth and development using ultrasound scans. These scans can help identify any signs of fluid buildup or other complications associated with erythroblastosis fetalis. Treatment for erythroblastosis fetalis depends on the severity of the condition. In mild cases, treatment may not be necessary. However, the baby's health will be closely monitored after birth. In more severe cases, treatment may involve blood transfusions to the baby before or after birth. These transfusions help to replace the baby's destroyed red blood cells with healthy ones. In some cases, early delivery of the baby may be necessary to prevent further complications. This decision is made based on the severity of the baby's condition and the stage of pregnancy. With early detection and appropriate treatment, most babies with erythroblastosis fetalis go on to live healthy lives. However, in rare cases, the condition can lead to long-term health problems. These problems can include developmental delays, hearing loss, or cerebral palsy. Early detection and treatment are crucial in managing erythroblastosis fetalis and ensuring the best possible outcome for the baby. Regular prenatal care, including blood tests and ultrasound scans, is essential for identifying any potential risks and implementing timely interventions.